I'm Tracy Tacket, family practice medicine in Niles, Michigan, with Lakeland Family Medicine of Niles. My husband and I have been in practice together since 2007. I grew up on the east side of the state. My grandparents lived in Berrien Springs the whole time, so we would always come down to southwest Michigan for holidays, summers, just to visit Grandma and Grandpa. My father's a physician, so I grew up in a doctor's home. Always wanted to be, I knew from the time I was a little girl, I wanted to be a doctor. I guess because I would go with my dad into the hospital, sit there and wait hours for him as he saw somebody in the emergency room. But there was an excitement, a knowledge, a compassion that I saw that I wanted. I wanted that for me. I really appreciate working with Doug. You hear these horror stories of how husbands and wives work together and they just bicker and fight, and puts a real strain on the marriage. So I think we can do it. I said, okay, let's try. And we did, and it was wonderful.
There's times when we can close the door and talk with each other about patients, patient care in general, and once again work together as a family to try and bring the best possible care to our patients.
I love being with the people. Sitting there and talking to them, and usually talking to them about what's going on in their lives, but when they come back and ask me, well, so how are you doing? And you sit there and you chat and you talk and you get to know each other, and there's a real sharing. For me, one of the most important things for a primary care or a family doctor or any doctor that you're going to, they need to be able to listen to you, hear what you're saying. If you listen to them, they're going to tell you what the problem is, and then you can go from there and treat it. I think that's an incredibly important and valuable tool, to listen to a patient, hear what they're saying.